this little flap here that's covering a hole. So does anybody know what this little flap is?
Epiglottis.
That's your epiglottis, and it covers the hole, which is called the what?
The glottis.
The glottis, right. So the epiglottis is the little flap, and underneath it there's a hole that's called your glottis, right? There's your epiglottis. Under is your glottis, okay?
Do we have to know what the nasopharynx is?
No,
Okay. Because I didn't know if it was
no.
specific.
Okay, and then close that up and we move on down. What's this big guy right here? Anybody know?
Trachea.
Well, it's connected to your trachea. This is your larynx. Okay.
The big.
Yeah, the
part,
big
the
hard
big
thing.
part.
So this is your larynx, and then you move down. It's connected to your
the
trachea right there.
Okay.
On your test, so the trachea and the esophagus are in the same spot. Just the trachea is on top of the epiglottis. Okay. A good way to tell them apart, the trachea is going to look like it has little rings around it, like a tree, okay? And so you can kind of see them a little bit if we move that cartilage back some. You see those little rings there?
Yep.
Yeah, that is how you can tell them apart. Also, if they have the esophagus pinned, they'll have it pulled out from underneath the trachea, okay? So that's a good way to know those, okay? Yeah, babe.
Posterior, anterior, I swear.
Anterior's closer, posterior farther away. Okay, so larynx, and then the trachea, and then look how weird these are the lungs, but look how weird these are. I just thought that was so
There's
cool.
a smoker.
Yeah, 4 packs a day. But yeah, so the lungs, yeah, the
Like, not
lungs
like
are
the
generally,
smokehouse.
the healthy lungs look like this, and they're encircling the heart, so they'd be coming around like that, okay? Lungs here, lungs here. And then the diaphragm is gonna be this muscle right here, okay? And a lot of these have been ripped up, but like here's the diaphragm on this one. The diaphragm will lay directly over your liver.
Show me on this one.
It's gonna be this one right here. It's kind of been chopped up, but if the pig was all together, it'd be like flipped over the liver right there. Okay?
Is this all gonna be like one pig on the test, or is he gonna have like?
No, there will be many.
Okay.
Okay, so that's all the respiratory system. Are there any questions on that?
Nope.
Okay. So now we'll move on to the digestive system. So the oral cavity is literally just the whole mouth, okay? This is a fancy word for mouth. And then we have the hard palate, which is here. And that is the one that has all the ridges on it, right? And that's going to be more towards the front of the mouth. So that's your hard palate. And then the soft area right here with no lines on it, that's your soft palate. Okay? And then we already talked about the pharynx, which is just this area here. And then now we're going to look at the esophagus. So remember, this is the trachea, right? If we go underneath there and pull this guy out, you see that smooth line right there where my probe's at? That's your esophagus, okay? And they'll have it probably like
okay.
pulled out.
Oh, just like that little.
Just like the tube that goes around.
Yeah,
Okay.
that's it right there, okay? And then the stomach, I'm trying to think which one of these is better to look at. Okay, so this right here is your stomach. This whole thing, it's pretty big, that my hand's on, okay? The stomach is gonna sit underneath the liver, right? And I think it looks like a balloon, like that's been popped, so kind of deflated. So that is your stomach, and then the liver obviously is this ginormous guy right here, okay? And then, so the intestines, these are your small intestines, okay? And then these really thick ones is your large intestine.
And what's that like cord called? It's like the little like spiral section called.
Like the end of it, like where it doesn't continue.
Where the stomach meets the intestine. You talking about that little,
No, it's called like a stack or something. I don't remember what it's called.
little
Talking about the sphincter? No, not the sphincter.
The
The
cecum.
cecum. Yeah.
Yeah, that's the thing. Like,
That is where. That's this part right here. So it's the end of the large intestine. It literally just stops. Okay? Alright. That's kind of like our appendix. So like it just like stops. So that's your cecum. And then large intestine. So we did the liver. Inside the liver, This one isn't as really green as I would hoped it would be, but inside the liver there will be this little area, and it's gonna probably be pretty green. That's your gallbladder.
Yeah.
Okay, so that's the one on this one here. All right. And then the pancreas is very, very hard to find. The only one I could find is right here. And for some reason it's really dark. But this, like what I'm holding up with the probe, that's your pancreas right there. It's a very, very tiny. And usually it's gonna be like a whitish, grayish color. But for some reason this one was like really dark. But it's right there on top of my probe. Yeah, it's
What's it
super, super
connected to?
tiny.
What's that connected to?
There's a bunch of connective tissue holding everything together in here. Okay. Yeah, it's very tiny. I highly doubt that they'll put it on the test, but just in case. Alright? And then the spleen is going to be this guy right here. So it's next to the stomach. So it goes liver, then stomach, and then the spleen. And the spleen's like this little flap. Kind of looks like a tongue to me. So like it just kind of flips back and forth. That's your spleen. Okay. Any questions over digestive system? Okay.
Do we need to know the functions of all these?
No, if he puts functions on there, it'll be like very basic.
Oh, okay.
So like, maybe like makes noise for like your larynx, or moves oxygen in and out of the body for your trachea, something like that.
Okay.
It won't be super in depth. Okay. So next we're going to talk about the circulatory system. So the circulatory system is a little bit overwhelming. So there's a few like tips that I always give people. So arteries and veins are going to be, or arteries are going to be what color? Red or pink, and then veins are going to be blue. Good. So if it is going out to the arm, that's going to be subclavian, whether it's artery or vein. And then if it's going to the kidneys, it's going to be renal. And then if it's going out to the legs, it's going to be iliac. So usually that'll help you get it narrowed down between two of them. Okay. So we're going to start with arteries first. And we're going to have to jump back and forth because some of these are a little messy. But this big guy here on the front of the heart, that's your pulmonary trunk or your pulmonary artery. Okay.
I'm gonna get up close and personal because I can't see.
Oh, you're fine. I don't care. Right there. Okay. And then, so your subclavian artery is gonna be, I forgot which one I had this on. I guess it is this one. Is gonna be this one right here. Okay, because see, it's going out to the arm. And no, it's not super pink, but some of these didn't dye very well. But this is your subclavian artery. Okay.
Well, like the pigs that Dr. Way be using, like, will they most likely be like whenever it's like pointing to, it'll be like pretty clear, like what it's.
Generally, yes.
Okay.
I'm not gonna say that
Like
there
if he was
aren't gonna
doing
be
the
like.
subclavian artery, like it would clearly, like the pen or whatever, would clearly be pointing to that.
Yeah, he
and
wouldn't
not,
just like stick it in and be
Okay.
like, guess it. No, it would be very clear. Okay. And then.
So is that a main artery that just runs into this? Okay.
Yep, so it comes out into the arm, and then once it gets out here, it branches off into different arteries. Okay? And then your brachiocephalic artery is going to be this one right here. It is the big guy that comes
Oh,
off the center of the heart, and it goes all the way up, and it splits off into a bunch of different stuff. But just know that, like, right when it comes off of the aorta, right here, is brachiocephalic artery. Okay? And then your common carotid, here's going to be one of them right here. All right. And these are going to be pink, and they're going to be in the neck, okay?
What were those called?
Common carotid artery. And then on the test, more than likely, it'll have left and right options. So, like, if I'm looking at the pig this way, what side is this?
The right,
That's the right, and this is the
left.
yes. It's the opposite of like what you're looking at. So, like, this is my left, but his right. My right, but his left. Does that make sense?
Yeah.
Okay. All right. Any questions so far?
No.
We're going at an okay pace?
Yes.
Okay. All right. So common carotid, you have one on each side, and then
Okay. I don't think I need.
this part right here, that the brachiocephalic is coming off of, that's going to be your aorta. Okay. I know it's really hard to see, but it's right there.
The smaller one, like next to the. Okay.
Yeah, right here.
Okay.
Right
Is it a separate thing or is it just connected to it? I can't really tell.
It's
to the pulmonary trunk or to the heart.
it's like the little. It's like there's the pulmonary trunk. Like,
Mm-hmm.
I don't know why I was pointing at like the video thing, but I'm like pointing on here. But like if you look up here, like that's the pulmonary trunk.
Yeah.
then
And
that's
the aorta, it
the
kind of
aorta's that
comes
little, like-
behind it.
Doesn't like the
It's like
aorta,
little, like,
also
thing.
like kind of because of the arch shape.
Mm-hmm. It's like a semicircle, right? Good.
So much easier. to see
Yep.
this.
Which is basically the same thing as the aortic arch. You can also, if you traced it, like, here's the aorta as well.
Oh.
And
see
it
that
goes
long thing right
all the
there?
way down and it
yeah.
branches out, yeah. Okay?
He most likely won't point to that, right?
It just depends. I
Okay.
mean,
I don't feel like we like really went over that like in class. I feel like we went to
Right.
like the main.
yeah,
the
and
vena
this
cava
is
and stuff
called
like that.
the dorsal aorta. So dorsal means back, like a dorsal fin, like
Yeah.
on, like, I don't know, like a shark or something. So like dorsal aorta, all right? And then your renal artery, so what do we say? Renal means it goes to the kidneys, right?
Why are their lungs so messed up on that one?
I don't know, but
Like,
it
looking
kind of
at it-
scares me.
I know.
It looks like they like dropped like acid or something on it. Like
Honestly.
just one little drop.
Okay.
Not the way it got banned.
All right, this isn't super clear, but you see this blue right here? Right underneath that, there's that pink. You see it right there? My probe's under it.
Yep.
That is your renal artery, okay? Right there. I know it's very dirty looking, but that's your renal artery. Renal will always be going to the kidneys, okay? And then the external iliac artery.
Oh, gosh.
So your aorta is going to come down and branch off. And right here's your external iliac.
Okay.
Okay,
The
that's
little
really,
one?
yeah. This is internal, so it's external.
Okay.
All right.
Kind of did bad on coloring that.
Yeah, it's pretty
Looks all the
rough.
same.
Yeah, it's rough. And then the umbilical artery, which this one is kind of ripped. This is the umbilical artery right here, okay?
Okay.
It'll be coming off of your aorta and go all the way to, like, next to the bladder, because this is, like, would be attached to the umbilical cord, okay?
I'm not even holding the phone anymore.
All right, any questions over arteries? Okay.
Honestly, it doesn't even like. I don't know if I'm just like underestimating this, but like, it doesn't seem that hard.
Okay.
Like as long as you know like a few of them, like you should know
I'm
the
scared
rest
of
of
the
them.
phylums. That's what I'm scared of.
All right, so next we're going to look at veins, and veins are blue, right? So up in the neck, we're going to have jugular veins. We have two of them. We have external and internal. So this is your external jugular, which is closer to the outside, okay? This is your internal jugular, closer to the inside, okay? And
Is that what
then,
you're saying? It's okay.
This is the spot.
you have your anterior vena cava and posterior vena cava. So anterior is going to be above the heart, so it'll be the blue directly coming off the top. And then posterior is going to be coming down right here. I know that looks pink, but that's just connective tissue. So posterior vena cava, anterior vena cava. All right. And then what do we think this one is right here that my probe's under? Where's it going?
Subclavian vein.
Mm-hmm. So clavian vein. Good. All right. And then, so you have your anterior vena cava right here at this area. So you're going to come up right before it starts to branch off into all this different stuff. This is your brachiocephalic vein, okay? So brachio means arm, cephalic means head, which makes sense, right? Because it branches off to the head and then to the arm, okay?
Is it like where they all connect, or like right below where they all
Right
connect?
below. So
Okay.
like directly before they start splitting off, okay? So about right there. And then renal again goes to the kidney, and we can see that pretty good right here. So that's going to be that blue guy right there, going to the kidney.
Alrighty.
Okay. And then we did jugular. Then the umbilical vein, so is just going to be on this side. This guy right here. It's not very blue, I know, but it'll be this one right here.
Well, we need to know like the hepatic veins.
No.
Bro, stop throwing out words I don't know.
Just
You could have just said
Alright.
liver veins.
that's not what it's called.
And then common iliac vein. So when your aorta starts to branch off, the first, or not your aorta, your vena cava. When it branches, if I can get it cleared out maybe. So it comes down and it Ys. The first, like, split is going to be your common iliac vein. So it's going to be that guy right there that my probe's under, okay? So it'll be that right there.
Cool veins.
All right. Okay. Any questions over veins?
No.
Okay.
Do you think it would be like, is he gonna ask for like which vein is this, or is it just gonna be like what is this?
It'd probably just say name the blood vessel.
Serious? Oh man, that's gonna suck.
Yeah.
I really just don't feel like it'd be that bad. As long as you know the difference between like an artery and a vein.
Well, look at how close they are, and if they're like the same color.
But like, I feel like he's gonna do a good job of separating. I don't know. I may just be
Okay.
underestimating how this test.
Next, we're gonna look at the urinary system. So obviously, this is the what?
for the pig.
Kidney.
This is the kidney. So your ureter. The ureter connects from the kidney and goes all the way down to the bladder. This right here is your ureter, okay? So you can tell it starts at the kidney and you can trace it all the way to the bladder, which is this, okay? And this just looks a little funky because I had to cut it back from the umbilical cord. That's why it looks weird. So this is your ureter, okay? And then this is your bladder, okay? Kidney, and what else do we have? Your urethra. Okay. So the urethra looks a little bit different in the boys and the girls. So this is a boy. So the urethra goes from the bladder out, okay? Right here. And then on the girl, which is right here, so the bladder sits on top of the vagina and like connects into it. So again, the urethra is on top, but it just looks a little bit different. And also the bladder was cut off of this, so that's why it looks kind of weird. But this is your urethra right here, okay? Okay, any questions on that? Okay, now we're gonna look at reproductive. So we will do the boy
Are like the majority of these
first.
questions on this exam gonna be on this pig?
A lot will be on the pig and a lot will be phylums, but there will also be plant
Are
questions
there
as
50
well.
questions on this?
Yep. Okay, so
There's 50 things in this pig.
looking at the male, so this right here, I know, and these are very, very tiny, I know. This right here is going to be your testes. Your testes is inside of this, okay? What's holding that together, this tissue, is the scrotum, all right? So if you go inside this, you're going to see a little thing that looks like a bean. That's going to be the testes, okay? And then there's going to be this really dark thing around it. That's the epididymis, okay? I tried to cut this out, and I chopped the first one up because it was so tiny. So I thought I better not try this one. So I highly, yeah. So like there would be the testes, and the epididymis would be coming around here. And you can tell what it is because it's much darker than the testes is, okay? But it's extremely, extremely tiny. Okay? And then, so this line right here that connects to the testes, this is called the spermatic cord, and inside of that is your vas deferens, okay? Oh my gosh. Okay. And then we talked about the urethra, which goes from the bladder, so that's that right here, okay? And then, so if the bulbourethral gland is underneath the penis, so like here is the urethra, and underneath that right here is the penis, okay? If we
That's
were
the
to,
penis down there, or
yeah,
the-
this is right here. It's very, very tiny, I know. Yeah, it's tiny. The bulbourethral gland got cut, but it would be right down in here, near the penis, okay? So it'd be down here,
What was that?
the bulbourethral gland.
Think of the basketball player bubble.
And
think of him as
then,
being a penis.
so the urogenital opening is just like if we were to follow
Sorry for watching this bubble.
this out, it would just be the opening to the outside of the body. That's your urogenital opening. Okay? Any questions on the male? Okay. All right, let's look at the female. So again, everything's very, very, very tiny. So this tiny, tiny looking bean thing right here, that's your ovary. Yep. And then, so you'll have two sets of like squiggly looking line things. The tiny set is going to be the oviduct. And then you have this really big squiggly line, and that's your uterine horn. Okay? So the
There's
uterine
one on
horn-
each side.
yeah, this one just got cut off. So the uterine horns come together to form the body of the uterus. So that's directly right after they come together. Okay?
What's that called?
Body of the uterus.
Okay.
And then as you work your way down, you can notice it gets a little bit bigger. And this part right here is the vagina. All right? It goes under the urethra. And then, so the urogenital sinus is going to be, so the vagina and the bladder, or the urethra, run together, like one's on the bottom, one's on top, and they come together and everything comes out one hole, right? So where they come together, that opening is called the urogenital sinus, okay? I highly, highly doubt that will be on the test. Just know that. So like if we were to like go all the way through here and like cut this back and open it up, you would be able to see like where it comes in, and that's the urogenital sinus, okay? And then the urogenital opening is again just like where these come out of the body at, okay? All right. And then we went over genital papilla is just like the outside area right there, okay? All right. That's everything on the pig.